It's great to see everybody. I am very excited to introduce our speaker this morning. If there's anybody who has an abundance of energy and who is suitable to speak to us about energy psychology, that would be Dr. Nora Baladerian. She's spoken here several times before, and she's always a delight. And we are truly excited to welcome Nora. If I could, at this time, I am enthusiastically delighted to welcome Dr. Nora Baladerian. Please join me in welcoming Nora.
Thank you. You are so sweet. Oh, thank you. Good morning, everybody. Ah! I'm not going to do that. Good morning. Go away. There we are. I have my own mic. Good morning. Start again. Isn't it great to start with an error? You get it out of the way. I wanted to make, may I make a couple of announcements? Sure. Okay, I'm really excited to tell you that, has anyone ever had a dream come true? Nobody? Not one person? Okay, anyway, I had, what Paula knows and what some of you know is that my special work has to do with assault victims, child abuse victims, and dependent adult abuse victims who have disabilities. And I've only been doing that for a short time, 36 years. And it's been just a pull and a push to get folks interested in my world, as I call it, and working with folks with developmental and other kinds of disabilities. And in 1991, I wrote a book on how to do interviewing, the forensic interview, with kids and adults with cognitive and I have to go back to the language, cognitive and communication disabilities. And then I got an opportunity to make it into a movie. Isn't that cool? And the movie was done, and the filmmaker said, "Hey, Nora, what do you want to be?" And I said, "You mean like when I grow up?" You know, and he said, no, credits on the film. And I said, "I want to be best boy," because my father always wanted a boy. And so I thought, that'll be the way to do it. And he said, "No, you can't be best boy because that's whatever a best boy is." And so I said, "Okay, I want to be key grip," because that always looked really neat to me. And he said, "No, that means you have to carry shit around." So, anyway. And so it couldn't be that. And I said, "So what are my choices? You know, stop making me guess and just give me my choices." And he said, "Well, you could be executive director." No, executive producer. Executive producer. And I thought, ooh, I want to be an executive producer, except what will my boss say? And I thought, I'm on the phone. And he's not calling him, so I'm executive producer. Isn't that fun? Yeah. So, and it's out. So, it's called Victims with Disabilities, The Forensic Interview. So it's my book, just me, my book into a movie. Ta-da! Isn't that fun? And it's available to you for $5,000 per copy to my offshore account, which I would love to learn how to do, or free. Most people are choosing option B. So it's free, but you pay for shipping, okay? And here's a little postcard that I made. You have to tell me, "Oh, Nora, I love your postcard."
Oh, we love your postcard.
Thank you. And it has the instructions on how to go to the link, purchase your copy, and that's it. So the postcards are on the back table, on Carol's table. We should call it Carol's table. On Carol's table, and I have to give this as a gift to somebody. How many think I should give it to Paula? Yeah. Ta-da! Okay, so I'm so excited about that. Then, guess what? This is off topic. I'm sorry, but I'm really, really excited about this. So then, the other thing that we really need to do is get better at that first response to child abuse calls that involve kids with disabilities. And it's my experience that a lot of times people freeze because they don't know what to do. And they go into, I don't know what to do, I don't know what to do, I don't know what to do, and then they don't do something, or they do something weird rather than doing the regular protocol because they're just not used to kids with disabilities. Or adults with disabilities, for that matter. So I got a grant to write a curriculum to teach cops, prosecutors, child protective services workers, and other first responders, firefighters, paramedics, EMTs, how to do that first response. Yay! So that's really good. Isn't that good? So we have it. And so then I thought, oh, wouldn't it be neat if we could make a movie? Guess what? We made the movie! Yes! So I'm very excited about that. And it's in the can. It's not out yet, but it'll be out. It will be out. It will be out. It will be out. Anyone have positive thinking? It will be out. And it's really beautiful. It's a beautiful film. This is a beautiful film. Paula, when you see it, you haven't seen it yet, right? Oh, you're going to fall in love. It's just, it's sweet. It's warm. It's factual. It's step 1, step 2, step 3. with the warmth of getting to know folks with disabilities. My favorite quote is from a cop who watched it and said, when I saw the people that were going to be interviewed, I thought I would rather respond to an armed bank robbery in progress than interview these people. But by the end of the film, I felt I could do it. In 55 minutes, he switched to, maybe I could do it. So I thought that was really pretty. The first responder video is even better. So it's like powerful, it's really great. And I got a grant, well, sort of. In manner of speaking, I got a grant to then deliver this first responders curriculum. So we're doing that curriculum, delivering it 3 times this year, 4 times next year, 4 times the next year, in various locations, San Diego, Sacramento, and Riverside this year. And then next year we're going to figure out where. But then I got another grant for my other dream. How many people know the name Frank Laubach? Okay. What he did was, correct me if I'm wrong, in the 1930s in Africa he was instituting a literacy program. And his motto became, each one, teach one. So I teach you to be literate, you teach him to be literate. Meanwhile, you're teaching her to be literate, and he's teaching her to be literate. So each one, teach one. So wouldn't it be fun to do that with the first responders curriculum? So I got a grant to do a train the trainer program. And Monday, Tuesday in Sacramento, we did the trainer program with a team. This is a multidisciplinary curriculum designed to be taught by a police officer, a prosecutor, a CPS professional, and a disability specialist. So we had teams come in like that, except one cheated and brought also a baby prosecutor and a forensic interviewer, because they figured, oh, more is better, right? And then Tuesday afternoon, we watched these teams deliver our curriculum. And we all felt like we had just birthed a baby. It was beautiful because they are going to go out to their communities and be able to deliver this curriculum. So I would have loved to have been able to offer this in Los Angeles, but we could not convene teams. We only need 4 people for a team. Law enforcement, prosecutor, CPS person, and a disability specialist. 4 people, that's it. But if somebody around here says, ooh, I could put together 4 people, I'll put a team right here, I'll put a training right here in Los Angeles. Okay, so if you want to do that. Anyway, I'm on topic. Hi, my name is Nora Baladerian. I'm a therapist. And I love doing therapy, and I love helping people. And over the years, I've been doing this for many, many years, I've wanted, you probably do this too. How many here are therapists? Okay, don't you guys go to conferences to learn new therapies? And why do you do that? Why do you go? Huh? Why do you go? Because you get C's. Why? Huh?
To improve the services you deliver.
To improve your services. Anything else? That's it? Yeah? Speak loud because I just acquired a little bit of a hearing impairment.
I like to be on the cutting edge of what is happening in my profession.
Wow, I like to be on the cutting edge. Ooh, that's cool. Well, yeah, me too. And I didn't realize it until I realized it, but then when I realized it, I realized it. A friend of mine yesterday, he says, do you listen to what you say? He said, you just said, I do better when I forget. He said, you don't. But you weren't listening because I was going next to the next sentence and it came out of my mouth too late. You know what I mean? Anyway. So what I was saying was, I also go to seminars. I want to learn what's out there, what's new. I've been doing this for 30 years, but there's always new stuff coming up, and people are learning new things. And so then as I thought back about it, this is the question I wanted to put to you, and I want it rapid fire and I want it loud. Are you ready? If you could have your dream therapy, anybody, not a therapist, a therapist, your dream therapy for working with kids who've been abused or experienced traumas, what would it be like? How would it work? Would it be fast, slow? Would it be, how would it be? Fast?
Fast and fun.
Fast and fun. Ooh, cool. Okay, what else? Painless. Good. What else? Interactive. Good. What else? Loud, loud, because you got to pay attention to my good ear. Loving? Is that what you said? Great. Anything else? Two more. I only want two more.
Successful.
Successful? That's a good one. Good. What else?
Creative.
And creative. Okay, good. So there I was innocently sitting, well, we're on the camera, around. And I read this article in the APA Monitor that said thought field therapy is no longer approved for continuing education for psychologists. What's thought field therapy? And why isn't it any longer approved for psychologists? Must be good. So, anybody got me diagnosed yet? Oh yeah, what? What? I double dare you. So, if anybody says ADD, I'll kill him. So, because I think I have the H, although other people say I don't have the H, but some people think I have the H, but I think I don't have the H. But anyway. So then I got off of where I was reclining and went to the phone, and I called the thought field therapy guy, and I said, hi, it just says here, you are no longer approved for CEUs. What's that about? And it was the guy who discovered it. So anyway, so I said, well, you don't want to call the guy who discovered something and said, I just discovered something awful about what you discovered. But did I do that? Oh, yes. Okay. So, and I asked him what that was about, and he said, well, what that really is about is that there isn't a body of research yet that supports it. And I said, so what? Does it work? He said, it absolutely works. And you ought to come and learn it. He's like that. You ought to come learn it. And I'm like, ah! And I don't have time. Anyone go through that first excuse? I don't have time. And it turned out that the training is a 3-day training, and it was at the very end of the January conference, right? Anyone ever get conferenced out? Yes, right. So I'm thinking by the time Friday rolls around, I'm not going to be a happy camper in Chadwick anymore. So I figured I could do it. I took the time off. Yay! So I went, and that was the end of me as not knowing thought field therapy. Because it is successful, and it's fun, and it works easily. Yes? I'm going to go through it right now. It's called thought field therapy. It has the worst name for a therapy in the world. Yeah, I will describe it. I will describe it. And I have handouts in the back. So please do not go rushing off for them. There's a purple one and a white one that I'll show you, but I'm going to go through my little shtick here first. Anyway, so worst name in the world. What in the heck is that? So anyway, I learned it, and one of the reasons that I really went for it, and I decided to take those 3 days, was he said that it was based in acupuncture, meridian therapy. And I thought, well, let's see, that's only about 6,000 years old. And I've had acupuncture, I've had acupressure. Anybody else here have acupressure? Okay, so you know the meridian system, you know it's based in energy, you know that it works, right? And so something based in that made a lot of sense to me. What it is, in a nutshell, is the application of acupuncture knowledge to psychology. Normally you go for acupressure for medical things, right? For liver or kidney or whatever. This is for trauma, anger, rage, upset, fear, jealousy, all kinds of things. Isn't that cool? Anything psychological. That made a lot of sense to me. Brilliant. Isn't that cool? Isn't that cool? So anyway, where are we? Right where we started. So, I did this on my Apple. And the way that we have this is on a jump drive. Isn't that fun? And I have no idea what the title slide says. But it probably says thought field therapy. And so this is trauma treatment, and it's for a recent trauma. I mean, like just a minute ago, a car accident kind of thing. Or a past trauma. It also works great for compassion fatigue or vicarious trauma that people acquire during the process of their jobs, and recurring exposure to trauma. And Paula wanted me to talk about, it's not like I'm all over the map, I know exactly where I am. Applying this therapy in New Orleans. Okay, how many of you wanted to do something about Katrina? Okay. And how many of you found an opportunity to really do something for Katrina? Okay, a couple of you. I felt really pretty powerless. I did not want to give money. Money is not something that I felt would get to what I wanted to do. So absent money, how many of you did something related to Katrina? Okay. So you know the video that I just gave Paula? Well, I've been showing it across the country for a long time. And in November, somebody wrote to me and said, when is it available? It's like, not yet, right? And how are you? I just did, you do that? How are you? Yeah, so how are you? Fine. And she wrote back and she said, fine, thank you. And that was it. And then I noticed it said, from New Orleans. And I thought, she can't be fine, thank you, in New Orleans, right? So I wrote back and I said, how are you really, right? And she got it. We have a wonderful story now. It's called Two Sides to the Story. And she sat down and she thought, you know, this person, she knew me because she'd been to several presentations. She's not here. She's not experiencing this. I can bloody tell her everything because she's not experiencing it too. And I don't have to worry about re-traumatizing her or anything. So she sat down for like 45 minutes and told me how she was. Well, I was in tears. So I wrote back and I said, how about I come and do some trauma therapy out there? And she said, would you really? Well, how do you say no to that, right? So then I got 12 of us, psychologists and other social workers, marriage and family therapists, and blah, 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 to go out to New Orleans and work with the folks at the hospital there. And it was just brilliant. It was just brilliant. And the CEO of the hospital, Charity Hospital, which is their big, like our USC Medical Center, and the chief medical officer came for the first session to get treated because they wanted to see if it works. Because they've had a bunch of people come through, you know, and whatever. And they actually felt better. And they went, ooh, this stuff works. So the CEO called the other hospital administrators to have them come, right? And they brought us back for another day. And the chief medical officer called his wife, which is really great, and to have her come and experience it. But she's a forensic nurse and professor at LSU. So that was really great. So we treat trauma very easily with this. Helen Keller said, although the world is full of suffering, it is also full of the overcoming of it. And this therapy works great for that particular quote. Isn't this lovely? So Charles Figley, who's one of the leaders in trauma work, basically said about thought field therapy that it's very powerful, it works very fast, it's non-invasive, it can't do any harm, and of all the therapies he's familiar with, this really one stands out above the others. I like that, stands out above the others. So that is pretty cool, I thought. What is a thought field? It says at the top. A thought field is like an energy field. You ever walk in and you meet somebody and you go, I want to go take a shower? You ever feel like that? Yeah. Okay, that's an energy field, all right? A thought field is when you have a thought and it's the feelings that are attached to that thought. So I want to do an example with you right now. Is that all right? Okay. Each of you, I would like you to, in your own little mind or your big mind, think of something. We're not going to ask you what it is. That when you think of it, it just makes your heart sing. Okay? Just go there for a minute. All right. How many went there? How many are feeling better now for it? Right. Feels good. Okay. That's a feeling attached to a thought, right? All you did was recall the thought, and here come those wonderful feelings. Okay? Could be the birth of a baby, could not be the birth of a baby. You know, some people didn't have a really fun time, you know, that last little push. I thought it was fun. Anyone here have a baby? Yeah. Did you sing happy birthday to your baby? Yes. You didn't sing happy birthday to your baby? I did. And I was singing happy birthday to you, happy birthday to you, happy birthday, dear. Boy or girl? No, I'm thinking about me, you know. I'm singing, happy birthday to you, happy birthday to you, happy birthday, dear. Unwrap. Margaret, happy birthday to you. Anyway, so that's a thought field. So as we can bring a thought to mind and have a very positive experience, we can obviously also bring a thought to mind that has a very negative feeling attached to it, right? Like a trauma. So that's energy. I wanted to introduce a friend of mine that I brought to the session. I wonder how fast everyone can get up and hold hands in a big circle. On a count of 5. 1, 2, 3, 4, 5. What a slow group. Okay, I'm going to break right here. Oh, with Wendy. Okay. Oh, perfect. Okay, I want you to hold. This is Rosie, everybody. Hi. Okay, I want you to hold her with your finger on the contact.
Okay.
Okay, and because people accuse me of stuff, I'm going to get in here. I want you to hold her and put your thumb on her contact.
Ring around the rosy,
Now I want you two to break hands. I want you to grab hands. Drop hands. Grab hands. Drop. Quick, quick, quick. Go around the room. Drop. Everybody has to be holding hands in order for it to work, except for the one that's dropping. Okay, drop hands, Carol. Yeah. Drop. Where are we? Okay, drop, grab, drop, grab, drop, grab, drop, grab. Okay, now I want to do something here. Rosie the rapper. Go ahead. Thank you. Okay, everybody back in your seats. Rosie says thank you. What is the purpose of showing you this? We're energy, and we're connected. Isn't that amazing? Isn't that like the best? Doesn't Rosie rock? Yes. So, that's Rosie. So, what we're doing is energy. We just had a great demonstration of we are energy inside. What are we, 90% water or something like that inside? So for treatment, what you want to do, as it says at the very top, this is how the therapy works. You ask the patient to identify the thought field. Now, a field is what? Like a magnetic field, right? If you have a magnet and you have a bunch of iron filings, and you put the magnet near the iron filings, what's going to happen? It's going to shoop, right? But if you have a magnet without the iron filings, how can you prove it's a magnet without using it? You cannot. But you still believe it's a magnet, right? Okay. In that way, thought field is an energetic field. Does that make sense? Okay. So we've already demonstrated a positive thought field. And now what we want to do is teach you how to work with a negative thought field that brings distress to the individual. Okay. So you ask the patient to imagine, to bring to mind the thought that is traumatic. That's the thought field. And then you notice the feeling. So you say on a level of 0 to 10, some people say, or 1 to 10, how distressing is it when you bring that to mind? Okay. So you can measure your progress. And then you treat the thought field. When they say, well, I was at a 10, but now I'm at a 0, it doesn't even bother me anymore when I think about that, you know your treatment's complete. Isn't that fun? Okay. So what it is, thought field therapy then, is a stimulation of those acupressure points that we talked about earlier in a particular sequence based on whatever it is you're treating. Okay? So what have I just done to myself? I have just completed a trauma treatment. What? That fast? Yeah. It's up to the TFT practitioner to know what sequence is required. So I just did a trauma treatment. But if I wanted to do an anger treatment, that's it. If I wanted to do it for rage, that's it. So depending on what you're treating, it's a different acupressure point because obviously the acupressure points correspond to different organs in the body, right? So for example, the end of the little finger on the inside near the nail, that's your heart meridian. heart meridian. What do you think that corresponds to psychologically? Heart. Loss? Yes. Abandonment, betrayal, heartbreak. It's also the heart itself, if there's heart problems. But it's those things. Abandonment, did I say that? And it's also anger. Because when we're hurt, we feel anger as well. So this is anger. Everything is followed up with a kidney point. For those of you in acupressure land, it's a K27. So you have to know which tapping sequence is required through the use of an algorithm. An algorithm is what? It's like a menu, which is what I just showed you, right? Or using a diagnostic procedure. If the menu doesn't work, which it does about 80–85% of the time, then you can do a diagnostic procedure to find out what tapping sequence worked with that person for that problem at that time. If it doesn't work, we know how to fix it. This has been used, as you can tell, what the title says, international successes. Okay, so this was done in Kosovo, and they did a little bit of documentation, and they treated 189 people, totaling 547 treatments with 99% success. How do you measure success? The person says 0 at the end. Or if they're using 1 to 10, they say 1 at the end of treatment. When I think that they bombed my house, I know that they bombed my house, I didn't go stupid, but it doesn't bother me anymore when I think about it. That's a 1. Isn't that pretty? When I thought about the rapist again, it was at a 10, but now I can think about it and it doesn't really bother me. Why? The energy of that trauma has been released from the body. It's energy. It's not magic. It's energy. And that's what we want to do. In Rwanda, 51 people were treated, 161 treatments, 99% success. Isn't that fun? People actually feel better. Same thing happened to us in New Orleans. People actually feel better. We've done now about 600 or 700 treatments. And in KwaZulu-Natal, 99%. Again, so you see a little bit of consistency. What other therapy administered within a half an hour gives you that kind of relief to the person? And isn't it groovy to be able to assist someone to feel better in the moment? We're talking about what is your dream for therapy if you wanted to do a therapeutic intervention. Isn't that one? Somebody said successful. Somebody said fast. Did you say fast? Yeah. This is fast. When I say fast, I mean between 5 and 20 minutes max for a treatment. So you have somebody coming in for rage or something like, or phobia. Phobia is a great one. Most people have a phobia. Phobia is an irrational fear. I had a terror of dogs my entire life. And I did work for the social work department. And you had to do home visits. I didn't do home visits. I said, if you have a dog, you're coming here. You can't do that. Well, yeah, I'm your worker, and I don't go where dogs are. I don't know why people have dogs. They're vicious animals with teeth, and they're furry, and they cost a lot of money, and they can kill you. And people have them in their homes. What kind of sense does that make? None, right? None. And people say, oh, he doesn't bite. And there's those teeth with that stuff coming down them, you know, and you're, and it's never been a problem for me, actually, because I just don't go where dogs are. But when you have to construct your life in such a way that you never go where dogs are, it could occur to you that you're the one with the problem. And that maybe it's not exactly normal, because there are thousands of people who voluntarily have vicious animals in their homes. And they're not dead. Who can explain it? I don't know. But I decided, okay, I'm a therapist, I'm a big person, I'm smart, blah, blah, and I'm terrified by dogs. Well, when Dr. Callahan said, oh, that's easy, a phobia is an irrational fear. Well, okay. I don't want to be an irrational person, but I'm like a human, nearly. And, and so he said, let's give it a whirl, right? And I didn't want to do it. So I actually came home and I asked my sister to treat me because I wanted to do it privately. Here's how she treated me. I can bother you, right? Okay, so you're the one with the problem. You're me, Nora. So I'm the sister, right? Nancy. And she says, identify the problem you want to treat.
Afraid of dogs.
Okay. On a scale of 1 to 10, how afraid do you get?
10.
10, okay. All right. Now tap under your eye like this. Kind of in the middle, on the bone. There we go. Right under your, if you're looking straight ahead, right under the eye. Okay. Now tap under your arm right here, right about where the bra strap comes. Really important for guys. Okay. And now right about here on your chest. A little lower, a little tiny bit lower. May I touch you?
Yeah, of course.
Yeah, right about there. I'll take you through how you find it in a minute.
Okay.
Okay. Okay, stop. Okay. This is my sister doing this. How do you feel now thinking about dogs? Say 7.
7.
I guess it works. Okay, now, okay, this is how she did it. That primitive and got the result. Isn't that fun? So meaning you don't have to be a professional anything to do this treatment.
So do you have a dog now?
There's always one, you know? There's always one. No. And the fact, a puppy? No. I don't have any vicious animals. I actually did have a dog, but it wasn't my fault. He came to live with me for about 9 months, and he was a Samoyed, and I named him Raindrop, and I was terrified, but I loved him. So I didn't overcome, you know, it's this desensitization stuff, forget it. It just helps you tolerate your fear more, but it doesn't make the fear go away. This makes the fear go away. So now I adore dogs. Oh, okay, there's a question. So I'm with my girlfriend in Pittsburgh, and we're sitting around watching the movies, and I have my favorite doggie near me, Shitsi, and Mia is over in the corner, and the kid is over there, and we're all watching a movie. And I said, hey, DJ, what's the name of my dog? You know, because I've adopted this dog into my heart now. And not the name. I said, what kind of dog is this? And she said, Rottweiler. And I said, no. This is a doggie. She said, it's a Rottweiler. I said, no, it's a doggie. So I never got past the Rottweiler. Actually, I should treat myself for the, you know, for the word. But I loved Shitsi. I just adored her. So the fear is completely gone after a 10-minute treatment. And that's about 8 years ago. And it's brilliant to do. It's really, really, really fun. So these are some of the things you've already seen, I'm sure, while I was blithering on about what you can treat. And here's an example in Rwanda of somebody being treated. Now, normally, you would not tap on the person. You do it like I did. Tap here, tap here, tap here. So there's no actual touching. I asked to touch you because I thought you were cute. No, because it was just faster to, you know, but I'll show you how you get to the treatments. So, this is a lot that you already know about trauma. You don't need to know that. Negative emotions include anger, guilt, fear, and grief after a what? Child abuse, sexual assault, even domestic violence. Oh, and it also includes illogical beliefs, you know, self-blame kinds of things, negative self-talk, and this causes disturbances. We treat the disturbances. We don't do, none of these therapies address what we're talking about, which is the perturbations, the disturbance in the energy field. Okay, we address the disturbance in the energy field. I'm not saying these other things are not good. They're good, but they work a lot better when you're not so messed up. Okay, when you're not having your nightmares, when you can sleep, when the anxiety is gone. Okay, I want to make sure that I get to where I want to get to. So this just talks about, you know, information, you know, the mind-body thing that people talk about, that the body captures those feelings and they have a hard time finding their way out. This releases them so that they can find their way out. Here's an example of phobia. This is in the Philippines. Dr. Callahan would happen to be in the Philippines. There he heard a little kid crying off in the wherever. And with an interpreter found out that this little girl had a terror of motorcycles. Well, they were in a rural area, and using a motorcycle was the only way to get to town for the family. So this created a little bit of a problem. It was like putting me in a family with dogs. So he said, let me see if I can help. And so here's the little girl, and she's not too happy, and he's showing her the points. Now, at that time, he was tapping on bilaterally. You don't have to do that. You can just do one side, or you can alternate if you want to. It doesn't matter. It's the energy. So he's showing her where to tap. and here on the back of the hand, the next sequence, and finishing the sequence. Now she's tapping on herself, and now she's happy on the motorcycle. Took 10 minutes. The family was really happy because there was no struggle getting her on. Now she's happy to ride the motorcycle. Isn't that a fun application? Here's the other thing I like about it. You have to be, I think, at least 10 years old in order to learn this. You don't have to be a therapist. My sister's a violinist. That's what she does. You just have to be a person who wants to learn self-treatment or helping other people. So when she fell down, she did something stupid, which we all do sometimes, and fell down, broke her hip, and she's lying on the ground, and in a lot of pain. Had broken her hip in 2 places, so she just did the pain treatment, okay? And just continued to do the pain treatment for a while. The point where I am, if you want to make a fist, and between the last knuckle and the 4th knuckle, you go back onto the back of the hand about 1/4 of an inch, you'll find a little depression there. Do you feel like it goes in there? Okay, that's just to find it. That spot is the thyroid meridian spot, okay? So by just tapping that, or some people prefer to massage that, about 30, 50 times, just a while, and then combine it with touching the K27 on the chest here, that'll relieve the pain. So she got to the hospital and they said, we've got to give you morphine and blah, blah, blah. And she said, I don't really need it. I'm not feeling that much pain anymore. She did this for a couple of hours. Never needed pain medication at all. When they put her in the bed, they said, okay, now x-ray's been done, da-da-da-da, now we can give you morphine for the pain. And she said, I don't have any pain, right? Well, you certainly have pain because, you broke your hip in 2 places. And she said, well, I don't have pain. It doesn't hurt. So what do you do with that, right? And they didn't say, how did you do it? I would have loved for them to have said, how'd you do it, right? Because you're not normal, but they didn't. So this is a little diagram of where there are 14 points and where all the points are. So it's on the face, a couple on the torso, and on the hand. That's where they are. I'll show you. This is, we call it the eyebrow spot, under the eye. Where's that else on the face? Here, here. This is embarrassment. This is shame. And isn't that interesting that if you said, Nora, your slip is showing, I would go, oh, okay, automatic. Don't we do that just automatically? Just stimulate those points. When we were in New Orleans, there was this woman, this is right here on the temples. This is for rage. And when we were in New Orleans doing treatment, this woman said, well, every night I just go home and I just rub here and I feel so much better. And we think, wow, people know it automatically. So some of these treatments stimulate things that we just normally do. So on the back of the hand, little finger I told you, the middle finger, index finger, this is the lungs. I'm not going to go through all of it, just to give you an idea how easy it is. So you're not, you're not having to, tap somebody's crotch or anything like that, or, there's nothing embarrassing. It's just on the top, right? And if they cannot tap themselves and they allow you to tap them, fine, or maybe a partner, then that works fine. But you don't need, here's another thing that I really like about it. Let's say that I'm treating a sexual assault victim. I never ask, tell me about what happened. I've never asked in my entire life. I just think it's re-traumatizing. Other people say it's helpful. Well, if it's helpful to that person, great. But if it's not helpful to that person, so I let people say, well, I want to tell you. And I'm like, okay, if you want to tell me and that's helpful to you, fine. But I never ask. In this, you never have to say a word. They never have to say a word. You can say, think about what happened to you. How distressing is that? 0 to 10. Tap, 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 tap. How is it now? 8. Tap, tap, tap. How is it now? 5. Tap, tap, tap. How is it now? Okay. They've got to focus on the same thought. Hallmark, it's the thought that counts. So if they are thinking about looking at the rapist, and in the middle of treatment they switch to another scene, it's not going to work. You got to finish off one and then go to the next. But what happens, treatment is like an onion. You go to the most important thing first, and then something else comes up that they forgot about, and then, okay, finish, and then it's kind of like a decision tree. So sometimes I'll go to the new thought, and then finish off the old thought. Or I go to the new thought, and by the time I get back to the old thought, they're done. Right? So there's kind of like a generalizing effect. So you rate, you focus on the distressing thought. The way to mess up this therapy is if they think about something else, like this is the weirdest thing I've ever seen. And this is never going to work. I want to go home. How do I escape from this psychologist who's clearly out of her mind? But if they focus on the thought and maintain that, then it'll work. And then you repeat until you get to a 2, and then you do your kind of reinforcement treatment. So now I said that there's a bunch of algorithms. That's true. It's like a ham sandwich. And you imagine the trauma treatment being the bread. Okay? So there's the bread, and then there's the bread. So you do the trauma treatment, you do something else, and then you do the bread again. Okay? So it could be pumpernickel, or you're doing rye, or you're doing whatever, right? But the ham in the sandwich is always the same. And that reinforces the therapy. And that's a simple tapping on that spot that we talked to you about before, and then doing some eye stuff. So I'll just run you through it right now. What you do is you tap there or massage, your choice, and close your eyes. And then you open your eyes. And then you look down. Some people say to the right. I never do because then I always look to the left. So I say look down and to one side. And then to the center, and then down to the other side, and then to the center. And then if you want to watch me, great. Then you continue rubbing, and then you move your eyes around in a circle in one direction, and then the opposite direction. And then count out loud 1 through 5 in English. 1, 2, 3, 4, 5. Hum 3 different notes. And then 1 through 5 again. 1, 2, 3, 4, 5. Okay, that's the treatment. So look how fast this can be. Touch here, touch here, touch here, touch here. Okay, close, open, down, down, round, round. What's next? Hum. Oh, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Treatment. Complete. How long did that take? Now, of course, I ran through it, very fast, but it's around a minute. Okay. And it doesn't matter how fast you do it or how slow you do it. Now, people who are neurologically challenged, you have to do it a little bit differently because they can't rub and count or rub and move their eyes. So you have to do it a little bit differently, which is true for people with autism generally. And people with other difficulties. So the other reason that I love this is that it works so well with people with developmental disabilities. So I don't need for them to be able to do play therapy, which is representational, which they can't do anyway. Or I don't need them to tell their story. They may be nonverbal or low verbal. I don't need that. I just need to say, think about when blah, blah, blah happened and do the treatment. And they feel better. I wish I'd have had a camera like this for one of the treatments I did. This is for a guy who's around 26. He has Down syndrome. He has severe mental retardation. He's low verbal. He was sexually assaulted by his daycare provider. Isn't that just lovely? And since that time, he's been all the stuff that you know about. Regression, nightmares. I don't need to go on, right? He's got all the blah, blah, blah. Plus, now he has a conversion. Now it hurts a lot when he urinates. What's that? He was sodomized. Why would it hurt when he urinates? Anybody? Nobody? It hurts when he urinates because that's how he has made it a physical thing. He's fine. Nothing happened to his penis. Nothing happened to his urinary tract. Nothing happened to the bladder. But that's conversion disorder, right? So anyway, so then he comes in, and we're doing the treatment. Mom is a wreck, so I did the thought field therapy with her first. And she was like, oh, my goodness, I feel better. Well, let's do it with your son. Okay, fine. And he's Spanish-only speaking, so, that was another interesting little twist. But he didn't speak too much, and so we did the treatment with him. And it was did anyone ever see FX or special effects? It was like his whole face lifted and changed. And whereas before treatment, he was sitting on the couch, and kind of melting into the corner of the couch as we were talking about this stuff, you know. And then after treatment, he was sitting up and he was playing with the toys that I have, the little gadgets that I have on my coffee table. And one of them is those things that you turn up one side, it says one thing, turns to the other side, and it says another thing. And he shakes it all down. He says, look, look, you know, and I'm like, that is so cool. So then he had to go to the bathroom, right? But his face is like, he's better. I know he's better. So he needs to go to the bathroom, and I'm thrilled, because now here's a test, right? And he went to the bathroom, and he came back all smiles, because it didn't hurt anymore. We treated him particularly for that. So, talked about that. This is why it won't work. You know, some people try to think positive. This is going to work. This is going to work. This is going to work. No, you think about the problem. If you're thinking positive, you're not treating the problem. So it's like you have a cut down here and you treat the person up here. What good does that do? Doesn't do any good. Focus on the problem, right? So that really works very nicely. So I learned this stuff. Remember, I was back at the Chadwick Hospital, and I learned this stuff. And, you know, what do you learn in a weekend? Well, actually, you learn all the treatments, and you practice all the treatments. You're just not great at it, you know. So the next day, I was sitting in Monday morning, 9 o'clock. I was in the room with a mother whose child had been sexually abused by her father, who had molested her. Big surprise, right? And there really is something there. Isn't that interesting? So, bye-bye. So, who thinks I have ADD? How many of you saw that spider? I felt it. You saw it? Thank you. You're afraid of spiders? Oh, we could treat you. If there were only time, we could treat you. It would be so fun. Anyway, so there I was at Chadwick, and the mother, and so she had reported the sexual abuse. Well, actually what happened, she didn't report. She had called me, because she knows a mandated reporter, called her insurance, Amazingly, I had just had a 2-hour cancellation, and I needed 2 hours to receive her. And this girl, the little girl, the 4-year-old, she comes in and she wants to tell me. She knows that I'm the authority somehow. So she wants to tell me what's going on. So I'm sitting there in therapy, right? And I have my notebook, and she says, are you ready? And I go, yeah, I'm ready. And she says, I want you to write down what I say. And I said, I got a pen, you know, I'm ready. And so she says, it was on Christmas Eve. And I said, okay. She said, what do you have? I said, it was on Christmas Eve. Okay. And it was around in the afternoon, and my grandpa took me to go see the Christmas lights. What do you have? The entire 45 minutes was like that. The entire 45 minutes. And so then I read back to her what I had, right? And so that was the initial, and then they wanted to do the mandated report, and I said, why don't you stay here while I do it so you know that I actually made this report, and blah, blah, blah. So fine. So the reason that Mom was upset on that Monday when I came back from Thoughtfield Therapy Land was that her brothers and sisters were furious with her for getting Dad in trouble. Dad was a pillar of the community. Dad was a volunteer, blah, 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 and a volunteer, blah, 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 and a volunteer, blah, 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 and he was a wonderful, wonderful person. And yes, he had molested her when she was little, but, you know, so what? She's grown up now, and he didn't do that to this little girl, and how dare she? So how do you think she's feeling? She's terrible. She's all boxed in. How could she abandon her daughter the way she'd been abandoned by her mother and never take care of the abuse? How could she, all the how could she's, right? And now she's got all of her family, not one, stepped out. All of her family furious at her for getting Dad in trouble. And I'm thinking, I know Thoughtfield Therapy now, but it's really nutty. Dare I do it? And then I'm thinking, dare I not? I've been given this gift. It might work. It might help her. So I said, well, you know, I just went to this therapy thing this weekend. How would you feel, you know, first time? And it looked really promising, and I don't know if it'll help, but in that moment, what else could you do to relieve her rage, her betrayal, that whole mix of feelings? So I just went for it. I figured, you know, this is a golden opportunity. And I went for it, and in 15 minutes she was, you could see, it was palpable. She was so much better. She was relieved. She was not self-blaming. She was not angry. And Dad was still, her husband was mad. He says, can I do that too? And I'm like, well, of course. Why didn't you jump in the first place? Oh, save a little time. But anyway, but she was feeling immediately better. Then we could talk rationally and calmly about why, of course, it was right for her to feel the way that she had felt. But the fact of the matter is that her brothers and sisters are going to do what they're going to do. She did the right thing. She did the right thing. Isn't that the emphasis? She did the right thing. She protected her daughter. And she walked out of there feeling pretty good. There's no other therapy I know of that could have had such a wonderful result with her and with her husband, leaving her feeling really strong in the space of an hour. Right? So it works really great with people. This is the guy I told you about, who are highly verbal, highly functioning, low functioning, just across the board. It's easy to learn. I love this. A man's mind, once stretched by a new idea, never regains its original dimensions. So guess what, you guys? You've been stretched. Oh, this is lovely. And here are a few questions. Is TFT like anything? It's not like anything else. So don't ask if it's like something, because it's not. It's like the world is round. No, it isn't. The world is flat. That's what we've been taught. We knew it. It's for generations. No, actually the world is round. Oh, okay. We've talked about how it works. How it fits into your practice is, as I mentioned, it's an adjunct. It's a great way to relieve the distress and then do the therapy stuff that you normally do. Okay? So you can learn it and integrate it, or you could refer out for a treatment or two and then use it. So this is how it works. There's a thought plus emotional distress. You do the TFT, and then you have the thought minus the emotional distress. Again, it doesn't make you stupid. It doesn't make you forget what happened. It just makes you feel okay when you're thinking about this. These are a few treatments that can be done. If you want more information, I do the trainings in Los Angeles. So if you want a training on there's a purple sheet in the back. It's 2-day trainings. I'm doing one on a Wednesday and then the following Thursday. So July 18 and then the 26th in West LA at my office, because there are people who observe the Sabbath and can't come on Sunday and want to come on Sunday, but you can't do it with the foundational stuff on Saturday, right? So we're doing a Wednesday and a Thursday, and then we're also doing a Saturday, Sunday. There's an advantage to doing the Wednesday, Thursday, and that is you get a whole bunch of stuff the first day. By the time the week comes around, you've had time to integrate it, to kind of practice it, to make sense of it. And there's good things with the Saturday, Sunday, so for people who come from afar, you know, it's easy. So this last session that I did was a bunch of people came up from San Diego, and one was just like, I'm only here because my boss made me come. You ever done one of those? Yeah. So, oh joy. Okay, so, fine. And I said, well, you're going to love this. And we get to the phobia part, and I said, anybody have a phobia? And she says, well, I'm a little bit afraid of heights. And I said, perfect. I love that. You know, I love it when people have a phobia. And so I said, let's go outside, because I have one of those Spanish styles that there's a balcony, you look to the garden part, you know, from my 3rd floor. How are you feeling now? Oh, around a 6. I said, great, let's go up to the roof. So we go up to the roof. And it's bad now because OSHA came, so now there's a railing. It used to be really great. You could just go right to the edge, you know, just a little tip. And, but anyway, there's a railing. Anyway, so we went up to the roof, and she would only go like 2 steps. She saw it was the roof, and I get it, it's enough. And we did a treatment of her and went right back up to the roof, and she's right out on the roof, and she's going, wow, look at the view. Hey, I could have never done this before. Wow, this is really interesting. Hands in the pocket, really relaxed. And so she said, okay, I'm a believer. I get it. I'm a believer. So if you want to learn more about this, you can contact me. There's the purple, let me see, for visual learners. There's the purple over there in the back sheet that tells you about the trainings and how to contact me. And there's another white one that really talks about how I converted to using TFT. Thank you very much. I hope this has been helpful.